Many thanks, Dr. Ugusari. I'd like to ask one question. So I was very interested in your COVID-19 results, and I think that an important question is whether that could be rolled out easily to other cities, particularly in terms of different cultural behaviors in Japan. So in other words, even if your social contact index may go down in one particular city due to cultural behavioral differences, this may not necessarily imply the economic effects that you envisage, and also the infection rates of COVID-19 that may be also differentiated across different cities because of the cultural differences.
Absolutely, that's a very good question, right? So that's I think one of the things which is very hard to put into a model. But of course, the cell phone mobility data in the normal situation already captures some of the latent social norms and some of the cultural conditions and so on, right? So for example, if you see India data, for example, people are much more closely packed, right, in a train or on a roadway and so on, right? Whereas if you see data from a US rural area, very different, right? So some of the cultural norms are there, but certain subtle cultural norms, like for example, East Asian citizens wearing a mask, right? Those type of things are much more difficult to kind of put into the model, right? And we can have some parameters which can kind of capture some of those things, and we can transfer certainly these models to other kinds of conditions as well. But that would be very, very interesting to kind of consider. One, the cultural norms that are there, and then the different kinds of behaviors that results in.
Okay, many thanks. Now a question from Peter Morgan.
Yes, thanks so much. I was wondering if you could explain how you get the income data for the Puerto Rico study.
The income data, so we have the National Household Travel Survey data. And so we have that for all the US, right? So, and we have it at the resolution of a zip code census tract level. So it is not at the individual level. So we are making the closest inference to a zip code or a census tract. So that's how we kind of make inferences to the POI, for example. If we know it's a Walmart, based upon the number of visits, based upon looking at some of the tax data, we can make estimates in terms of what the amount of revenue that they generate and so on.
So these are the average income levels in that specific tract?
That's right. That's right.
Okay, thank you.
May I add one specific point to that as well? We do get the income data from that survey as well, but also from the American Community Survey.
Yes,
that provides us with data for each census block. So I think it's much smaller than a census tract. So it's although we're using the average of that area, it's a very fine-grained data source.
In Sonobe, please go ahead.
Thank you very much. Thank you very much, Professor Kusuri, for very interesting research, very interesting findings, and very efficient delivery of those findings. I have a question about income inequality, or page 16, I guess. So
are you able to see the screen?
Yeah. No, I cannot.
Okay.
Screen.
Okay.
Yeah, that one. Yeah, exactly. This lower right diagram showing the income inequality. Then in this diagram, the horizontal axis measures the taxable income. This must be the taxable income of residents of those Minato, Chiyoda, Chuo, Nerima. But how about the vertical axis? this daily contact index is not necessarily the contact of among those residents, but this must include those people who are coming from other places. And then those Minato ward and Chiyoda ward, those places which have relatively high taxable income, all the central business districts full of the headquarter offices of big companies. And then people working such big companies' headquarter offices are commuting from Neiriwa ward and those places. But after the outbreak, especially after the state of emergency declaration, those commuters stopped commuting and they stay at home with children. And so they went to supermarket and then also go to the small parks with children. So the contacts are relatively high, remain high or even higher than before. But those central business districts became like a ghost town. So that's why the social contacts became very low. So if you replace the horizontal axis by the another ones, such as the ratio of daytime population divided by nighttime population, then you will have the same, almost same diagram, I guess, because that ratio and the taxable income must be very highly closely correlated. So I think this interpretation written the right side, income inequality, richer reduced more contacts. I don't think the richer people behave so nicely. So I know many rich people, they never change the way of life. So I think this is just a result of the reduced commuting, reduced working in the central districts. Okay. And then, but as a result, so those residents in such expensive places in central business districts enjoyed less congested environment. In that sense, there is a income inequality. So those people living in Nerima have more congestion than before. So in that sense, they are suffering. So yeah, so income inequality exists, but this interpretation, richer reduced contacts, I don't really believe.
That's a very astute observation. And I'll try to answer at least part of the question, and then Taka can fill in the rest as to how our analysis is done, right? So when we say the daily contact index, it is not for people who are necessarily visiting that particular location. It is for people who, because we can infer the home locations of people in these different areas, right? Depending upon the nighttime durations that they actually stay in and so on. So we don't know the exact home location, but we know the area where they live in. So if we were to observe the people of these different neighborhoods, and we know the average incomes in these neighborhoods, and then measure the contacts that are there for these people, and then aggregate them, that is what this social contact, the daily contact index would actually be, right? So it's not the contacts that are there in that particular area, but it's actually the contacts of people who either work or reside in that area, and then they actually kind of go to different locations, or they're just staying home. But your second point about, yes, the CBD becoming a ghost town because of these restrictions, which shows this changes in behavior, I think that is certainly true. And yeah, our study does take that into account. So we actually can put some of those, but I like the index that you actually proposed. We actually can also do that analysis, and we can see how it would actually come out to be. Taka, do you want to add something?
Yeah, I just think Dean Sonobe's point of view is also correct. I think there's two effects that we're observing in this figure. Both observations are partially true because this index is only calculated for people going outside their homes. So it is true that the people with higher income had less contacts outside their homes, and that's also partially true. Also because people from other areas are not coming into those higher income places. So I think there's both sides of that. The story is true, and we need to do some more investigation to really look into the effects of these two effects.
Right.
Thank you.
That's a very good comment. I think we can take that into account in our future work.
Yeah.
Okay, many thanks. I think we have one more question from DD Kim. Please go ahead.
Thank you very much, Dr. Satish. Very, very interesting the study. I'm just curious that the difference between the non-compulsory measures and then compulsory measures, especially in Tokyo. So even though Tokyo took non-compulsory measures, so resulting reduced number of the mobility amounted 90% or 80%, the 10 or almost 90%. So then I'm just wondering how this differentiation between the non-compulsory measures, compulsory measures is significant in your study, especially taking the example of Tokyo.
Right. So actually, I mean, our analysis only goes until the end of actually mid-April. And I don't believe there were any compulsory measures, significant compulsory measures in Tokyo by the time. So all of our effects that we actually see are primarily from these non-compulsory measures that are there. And what our key insight is, people already kind of self-discipline themselves, and they're already reducing the contacts. Even though there were not strict lockdowns, there were no strict directives from workplaces and things like that, right? But analysis is primarily from these non-compulsory. But our US analysis, the one which I presented from New York, right, accounts for this one right here, accounts for this, some of the compulsory measures, because New York was completely shut down and the transit was shut down for like almost the first time in 90 years. And so a lot of changes, a lot of compulsory measures were put in place in New York. And here you can see the effects of those type of compulsory measures in terms of the mobility restrictions. And given the kind of, again, the comment which John, I think, made, the norms, cultural norms that are there, we don't see actually, even with these compulsory measures in New York and many other places in the US, we don't see even that level of reduction in terms of the social context. We don't go to almost 80–90% reduction. So I think different countries, depending upon the measures they take and depending upon the kind of how people change their behaviors, have different reductions in terms of the social contacts. And our current analysis specifically in Japan, right, we are going to do further from the last 1 month of data until the end of May. And this may kind of reveal some other additional insights. And we are kind of waiting to see what those would be.
Thank you.
Many thanks. We have one final question by Linda. Please go ahead, Linda.
Thanks, John, and thanks very much for the excellent presentation. You briefly mentioned the effects of the introduction of the gig economy, like Uber, on the main economy. I was wondering if you're also looking at how the crisis has affected the gig economy workers themselves, like the Uber drivers, all of the delivery drivers who have, and how the quality of life, which you also mentioned, has been affected by the crisis. Because they were some of the most vulnerable workers in developed countries during the crisis. Thank you.
Right. That's again a fantastic question. So actually my team is actually collecting data right now because we have some tools to collect Uber trajectory data and how many Uber trips are there in any given time and so on. So we are actually exploring that specific topic right now to see not only the aggregate reduction in terms of Uber and Lyft and this broadly FHV kind of trips, how many are these reduced and where they're reduced, but also to see which segment of the population is it actually impacting more? Maybe in Manhattan kind of an area which usually has about more than 60% Uber trips in New York City, there might not be a significant reduction, but in Brooklyn and Bronx, which are more poorer neighborhoods, the shock is even more, right? So we may not really get all the socio-demographic information because of the way we actually collect this data. But if we supplement that with the very first techniques I talked about, the survey data, I think we'll get a fuller picture of the differential impacts that are there due to the pandemic on the gig economy, right? So, but our first study is just using these big data sources to understand the spatial differences that are there in terms of the reduction in the number of trips and which locations are affected more due to reduction, right, in ridership from people, right? So that's something, and our preliminary results show that across the board, pretty much across all the cities, there's a reduction of almost 80% drop in terms of these FHV trips. Similarly, on the transit, it's somewhere close to like, in Purdue, for example, I talked to the transit agency and the board said there's 78% reduction in terms of their transit ridership and also micro-mobility ridership. In urban areas, MTA, which is in New York City, almost about 85% reduction in terms of the trips for the same time last year, right? So I think we need a deeper investigation into looking at the social demographics and also seeing exactly which income groups and which type of educational backgrounds and races are affected more by this. We do have some hypothesis along these lines, but we need to kind of test them more carefully. But our preliminary investigation is along using these big data sources.
Thanks very much, Dr. Satish.
Thank you very much. Bihang, we have one final question if we have a few minutes extra. Thank you. Please go ahead,
Okay,
Bihang.
thanks. First, thanks for very insightful presentation. Actually, I have a question. Currently, when a country implement lockdown or emergency measures, it was implemented actually uniform for everyone and every locations. But from the real case, we found that, for example, in Japan, actually the infection mainly happen in like hospital or in those nightclub located in Shinjuku. So I'm wondering whether we can like calculate some infection risk index so that maybe in those places with high infection risk, the government could take stringent lockdown measures. And for the rest of places, maybe lockdown could be relatively lax, so that the cost would not be so high, and people in those low-risk regions can go to normal. I mean, in terms of life, study, and also work. Yes.
Right. That's a important question to consider, right? So I think one of the important insights from that question that you're referring to is every contact is not the same, right? Some contacts are more risky than others. So we need to weight this riskiness differently. And if you see, I mean, every infection, especially in COVID-19, is because of a contact, right? I mean, because someone comes in contact, that's why we have the social distancing as an important way to reduce these infections, right? So the proximity is really what causes these infections. So this model, which I've showed, which I've not explained fully, but which I've showed, the SEIR model, right, considers the different weights in terms of these infections. So a person might be infected, but the person may not really spread to everyone nearby. A person might be infected and they might infect some other people nearby. Some of them might be more susceptible and some of them might be less susceptible. So if you were to consider hospitals, for example, you would put a higher weight for these infections to actually happen. So depending upon the riskiness of these locations, right? Depending upon the number of cases, which already might be there, or depending upon the the kind of locations that might be there, we can kind of change these weights in this SCIR model and then we can predict the number of infections much more accurately, which is what we do for this New York City study, actually, right? So we can kind of account for that in this system model that we actually have here. But remember, even in the hospital case, the infection is happening because people are coming in contact with one another. If they did not visit the hospital and the health workers are not in close proximity to the patients, they wouldn't be infected, right? So the mobility data actually does reveal that information, but it doesn't really give us those weights that we need to put in terms of how different contacts might lead to more infections or less infections.
Okay, thank you very much.
Thank you very much, Professor Okusuri, for a very interesting presentation and comprehensive answers as well. I would now pass to Dean Stanobit for some final remarks. Thank you.
Well, thank you, John. Yeah, I didn't expect. Okay, thank you very much, Professor Okusuri. Yeah, we are so excited. So many questions, and please come back to ADBA to make another presentation.
Definitely, definitely.
Yeah, thank you very much. Good night.
Yeah, thank you very much. Yeah, pleasure. Yeah, thank you. Have a good day. Bye-bye.
Bye.
Thank you very much.
Thank you. Bye.